Okay, let's dive right into what is arguably one of the most terrifying scenarios for any parent or guardian: a child knocking out a tooth. We have all been there, or at the very least, completely dreaded it. You hear that heavy fall, the sudden cry of pain, and then you see the blood. It's panic inducing, right? Time practically stops. But in this explainer, we are going to break down exactly how your calm, immediate actions can literally save their smile. Now, a knocked out tooth is visceral. It's messy. But in this exact moment, you have to remember one crucial thing. You are quite literally racing against biology. You see, there are these incredibly delicate cells on the tooth's root. They're called periodontal ligament cells, and they begin to die rapidly the very second they hit the open air. Why does that matter? Because those cells are the biological glue that helps the tooth reattach to the bone. If they dry out, the body is going to reject that tooth, even if you have the best world-class dentist putting it back in. So here is our emergency survival guide. We're going to cover the golden hour window, the 3 rules to save the tooth, identifying baby versus permanent teeth, stopping blood and pain, and finally, red flags that mean you need to head straight to the ER. Let's kick things off with Section 1, the golden hour window. Let's start the clock. We really need to talk about the most crucial time frame in pediatric dentistry. You have a 30 to 60-minute window, what dentists call the golden hour, to act before those ligament cells die off and the body totally rejects the tooth. And honestly, 30 minutes is your primary target here. This means you do not have the luxury of time. You can't go home, brew a cup of coffee, and search the internet for a plan. The actions you take right then and there, literally on the playground or the driveway, will decide the absolute fate of that tooth. Because look at this, speed truly matters. If you can get that tooth replanted within 30 minutes and you've stored it properly, you're looking at an incredible 85 to 90% success rate. That is incredibly reassuring. But, and this is a big but, as the minutes tick by past that hour mark, that success rate plummets drastically because those vital root cells are just dying off. Moving on to Section 2, the 3 rules to save it. Think about 8-year-old Julian who took a hard tumble and knocked out his tooth on the playground. His mom, Clara, she didn't panic. She followed 3 non-negotiable, immediate first aid steps. Find the tooth, rinse it gently, and store it properly. Skipping or messing up even a single one of these steps can cost your child their tooth. So step 1, obviously, locate the tooth. Step 2, clean it if you absolutely have to. And step 3, get it into the right environment immediately. Let's break down exactly how to pull this off flawlessly. Rule number 1. When you actually find the tooth, whether it's lost in the grass, sitting on the asphalt, or maybe even still in their mouth, never, ever touch the pointy yellowish root. Your fingers will physically crush the vital living cells needed to reattach it to the bone. You must only pick it up by the crown. The crown is just that stark white part of the tooth that you normally see when your child smiles. Seriously, treat that root like it's radioactive. Keep your fingers completely away from it. Okay, rule 2. If the tooth is visibly dirty, let's say it fell straight into the mud, gently pour cold milk or bottled water over it for no more than 10 seconds. But listen to me, never scrub it or wipe it dry. No soap, no mouthwash. And whatever you do, do not wrap the tooth in a tissue or a paper towel to transport it. Any kind of scrubbing or drying motion will instantly strip away and destroy those essential microscopic living cells we just talked about. Which brings us to Rule 3, storage. Cold cow's milk is going to be your best, most accessible choice, while regular tap water is actually your absolute worst enemy. Now, Hank's balanced salt solution is the gold standard medical option, but let's be real, you're probably not carrying that around at the park. So run to a nearby cafe, a neighbor's house, or your own fridge and grab some cold cow's milk. The pH balance and the proteins in it protect the tooth perfectly. Tap water, on the other hand, is hypotonic. That means it actively forces the root cells to swell up and burst. Oh, and don't even bother with plant milks like almond or oat. They just don't have the right biological makeup to help here. All right, Section 3, baby versus permanent teeth. This is a massive distinction that completely flips your action plan. You need to identify the type of tooth. You must never attempt to push a baby tooth back into the socket. If you do, you risk jamming it right into the developing permanent tooth bud underneath, causing irreversible damage. Pediatric dentists all over the globe are unified on this. So if your kid is under 6, it's almost certainly a baby tooth. They're smaller and stark white. Permanent teeth usually start showing up around age 6 or 7, and they are noticeably larger and slightly more yellowish. Bottom line, only permanent teeth should ever be saved and replanted. Let's move to Section 4. Stopping blood and pain. So the mouth has an incredibly rich blood supply, which unfortunately makes mouth injuries look like a scene straight out of a horror movie. But once that tooth is safe and secured in milk, your very next priority is managing your child's physical trauma. To stop that heavy bleeding and help with the pain, have them bite down firmly on some clean gauze for about 10 to 15 minutes. If it just won't stop bleeding, try the tea bag trick. Have them bite down on a moistened, cool black tea bag. The tannic acid in the tea acts as an astringent and naturally constricts the blood vessels. You'll also want to use an ice pack on the outside of their cheek for swelling, give them appropriate over-the-counter pain meds, and always keep their head elevated to lower the blood pressure in their head. But here is an absolutely critical warning. Stick to children's ibuprofen or acetaminophen and absolutely avoid aspirin. Aspirin actually makes bleeding worse and comes with the risk of a fatal condition called Reye's syndrome. Since aspirin actively thins the blood, it'll unravel all that hard work you just did trying to get the socket to clot. Keep it strictly to Tylenol or Motrin equivalents, okay? Section 5. Red flags for the ER. Finally, we have to figure out if we're dealing with just a dental emergency or a potentially life-threatening medical emergency. The face and head take a ton of impact during a bad fall. Before you rush straight to the dentist, do a really quick neurological check. If you see any signs of a severe concussion or a jaw fracture, bypass the dental clinic entirely and go straight to the hospital ER. If they lose consciousness, even just for a split second, if they're vomiting, if their pupils are unequal, or if they simply can't bite down normally without agonizing jaw pain, the tooth is secondary. You're now dealing with a potential traumatic brain injury or bone fracture, and you need hospital-level care immediately. But hey, let's say there are no medical red flags, and you make it safely to the pediatric dentist within that golden hour. Here is the exact timeline of what happens next. They will quickly numb the area, expertly slip that permanent tooth right back into the socket, and then they'll cast it with a splint so it can heal. They use a sterile saline to clean the socket first, place the tooth in, and then use this tiny, flexible wire or resin to essentially glue it to the healthy teeth right next door. It is literally a tiny cast for a tooth, and it usually stays on for a few weeks while those ligaments have time to properly reattach. Thanks for joining me for this explainer. The very next time you hear a heavy fall and that sudden cry, you now have the exact blueprint to act fast and potentially save a smile. But it really begs a bigger question, doesn't it? How many other common childhood emergencies are we handling completely wrong, just because we don't fully understand the biology behind them? Think about it. Stay calm, act fast, and keep learning. Catch you next time.